right. Hello, everyone. My name is Kyle Peniston, and with me today is Deepak Sumar. And welcome to our presentation for strategies and challenges of networking in healthcare organizations, enhancing collaboration, resource management, and patient outcomes.
Hi, everyone. My name is Deepak Shinar, and I am excited to talk and present with Kyle in this presentation today.
All right, welcome, everyone. So, a brief introduction. Imagine a world where healthcare professionals can seamlessly communicate and collaborate, where vital information is a necessity, and where patient care is optimized through shared resources and coordinated efforts. This vision is not just a dream, but it's a tangible reality made possible by networking in healthcare organizations. In today's complex healthcare landscape, effective communication, collaboration, and information sharing is paramount. Networking plays a pivotal role in connecting healthcare professionals and organizations, enabling them to share resources, collaborate on patient care, and drive research initiatives forward. In our presentation, we will discuss an overview of networking in healthcare organizations, highlighting its importance and setting the stage for an in-depth exploration of its benefits, strategies, and challenges in a networking context. Networking in healthcare is like building a bridge between professionals, allowing them to collaborate seamlessly and sharing vital information. This connectivity enhances patient care by enabling healthcare providers to consult on cases, share expertise, and coordinate care more effectively. Networking opens doors to a plethora of resources that might otherwise be out of reach, from cutting edge research, finding to specialized medical equipment. These resources enhance the quality and care provided to patients, ultimately improving their outcomes. By improving collaboration and access to resources, networking in healthcare leads to enhanced patient care. Healthcare providers can make more informed decisions and deliver personalized care tailored to each patient's needs, ensuring better outcomes and higher patient satisfaction. Furthermore, networking streamlines processes, reduces duplication of efforts, and ultimately leads to increased efficiency and cost savings for healthcare organizations. This efficiency translates to more time and resources that can be dedicated to patient care, further enhancing the overall healthcare experience. While networking in healthcare is not just about connecting devices, it's about connecting people, ideas, and resources to improve patient care, drive innovation, and ultimately save lives. Despite its numerous benefits, networking in healthcare organizations comes with its own sets of challenges. Limited resources for networking activities, like budget constraints, often limit investments in networking infrastructures and technologies, as well as the ability to train staff on new networking tools. Time constraints for healthcare professionals. Healthcare professionals have demanding schedules, leaving limited time for networking activities and impacting the effectiveness of networking initiatives. Strict HIPAA privacy regulations must be adhered to when sharing patient information over networks, and the risk of data breaches and cyber attacks pose significant challenges for securing patient data. Healthcare professionals may be resistant to adopting new networking technologies due to unfamiliarities or disruption to workflow, requiring effective change management strategies and education about the benefits of new networking tools. And now, Deepak.
Thank you, Kyle. I will take from here. I will talk about the strategies for overcoming challenges. The first challenge that we have is prioritizing networking in organization's strategic goal. So the first point we have is establish clear objectives. Define specific objectives related to networking infrastructures that align with organization's overall strategic goal. And these objectives could be improving data accessibility, enhancing patient care coordination, increasing operational efficiency, and ensuring compliance and regulatory standard. The second point is executive sponsorship and leaderships. So gaining support, buy-in from executive leadership for prioritizing networking infrastructure initiatives. So executive sponsorship can help secure necessary resources, overcome organizational barriers, and communicate the importance of networking and infrastructures to stakeholders across the organization. The third point we have is integration with strategic planning. integrate networking infrastructures, prioritizes into the organization's strategic planning process, make sure that networking initiatives are considered alongside other strategic priorities and are reflected in the organization's long-term plans and roadmaps. Cross-functional collaborations foster the coordination between IT department, clinical staff, administrative teams, and other relevant stakeholders. And this can look like for planning, design, implementing networking infrastructures initiatives to ensure alignment with operational needs and workflow. Performance measurement and evaluation define KPIs to measure the effectiveness and impact of networking infrastructure initiatives. Regularly monitor and evaluate KPIs to access process, identify the area of improvement, and demonstrate the value of networking investment to organizational stakeholders. The last point on this slide is communication and change management. Communicate transparently with employees, patients, and other stakeholders about the importance of networking infrastructure and its role in achieving organizational objectives. So implementing change management strategies to address resistance to change and ensure smooth adoption of new networking technologies and processes. By following these steps, integrating network infrastructures, prioritizing into organization's strategic goal, and healthcare industry can effectively leverage technology to enhance patient care, improve operational efficiency, and achieve long-term success. Same slide. Second strategies for overcoming challenges is allocating resources and budget for networking activities. Allocate adequate resources. Allocate sufficient financial and human resources to support developing, implementing, and maintaining networking infrastructure initiatives. This may involve budgetary allocations for hardware, software, training, and networking and IT support personnel. Cost-benefit analysis based on impact. Conduct a thorough cost-benefit analysis to demonstrate networking infrastructure initiatives' potential return on ROI. Highlight long-term cost savings, provide efficiency, and better patient outcomes can justify allocating resources and budgets. When doing that, prioritize networking infrastructure projects based on their personal impact, based on their potential impact on addressing key challenges faced by the industry. Focus on initiatives that directly alleviate limited resources, streamline workflows, and alleviate time constraints, and enhance privacy security measures to mitigate concerns. Partnerships and collaborations. Build partnerships with technology vendors, government agencies, and other healthcare organizations to share resources, expertise, and costs associated with networking infrastructures. Also work with If you work with government agencies and other organizations, it helps stretch limited resources further while facilitating and adoption of new technologies. Allocate flexible budgets. Flexible budget helps with adjustment based on evolving needs and priorities. This adaptive approach enables healthcare organizations to allocate resources where they need the most, addressing time constraint and overcoming resistance to change. Pilot programs and proof of concept. Allocate a portion of budget for pilot programs and proof of concept to test new technologies in real-world healthcare settings. Demonstrating tangible benefit and addressing concerns through small-scale trials can gradually overcome resistance to change. Initiative programs. Implement initiative programs to encourage healthcare professionals to participate actively in networking infrastructure activities. Recognize, reward, and help motivate staff to invest time and effort in adopting new technologies and practices despite not having time. Patient-centric approach. Prioritize budget allocation for networking infrastructures initiatives directly impacting patient care and satisfaction. Emphasizing the positive impact on patient outcomes can garner support from stakeholders and justify resource allocation despite competing priorities and limited resources. Next one. 30 strategies for overcoming challenges. Providing training and support for staff to engage in networking. Provide tailored training program. I know that employee development is costly to organizations. However, developing tailored training programs that accommodate the busy schedules of healthcare professionals, offer flexible learning options such as online modules, self-paced courses, and lunch and learn sessions to overcome time constraints, and allow staff to engage in networking activities at their convenience. Role-based learning. And training. Customized training programs based on the specific roles and responsibilities of healthcare professionals provide targeted training modules focusing on networking tasks relevant to each staff member's job function, help them acquire skills efficiently and effectively. Peer-to-peer mentoring. Establish peer-to-peer mentoring programs where experienced staff members can mentor their colleagues in networking activities. This informal support network fosters knowledge sharing, builds camaraderie, and encourages collaboration among staffs, overcoming resistance to change through peer influence. Cross-departmental collaborations. Encourage collaborations between IT department and clinical staff in designing and delivering training programs. By involving healthcare professionals in development process, training content can be tailored to address their unique needs and concerns related to networking technologies. Continuous learning culture and feedback mechanism. Establish feedback mechanisms to gather input from staff regarding their training needs, preferences, and challenges encountered in engaging with computer networking infrastructures. Use this feedback to improve training programs, ensuring they remain relevant and effective in addressing staff concerns. Leadership support and communication. Secure leadership support for training initiatives and communicate the importance of networking skill development in achieving organizational goal. Leadership's endorsement can help overcome resistance to change by signaling the organization's commitment to investing in staff development despite limited resources. Next slide. The fourth strategies to overcoming challenges is addressing privacy and security concerns through policies and procedures. Have comprehensive policy and procedures, develop comprehensive policies and procedures to govern the use of computer networking infrastructures in healthcare settings, with a strong emphasis on privacy and security considerations. These policies should outline clear data access, transmission, storage, and disposal guidelines to mitigate privacy and security risk. These policies should also outline how devices are handled, accessed, and destroyed after end of life. Regular security training. Provide regular training and education sessions for healthcare professionals on privacy and security. Best practices related to computer networking infrastructures emphasize the importance of safeguarding patient data and raise awareness among common threats like phishing attacks and malware. Use of access control mechanisms and encryption technologies. Implement robust access control mechanisms such as role-based access control and multi-factor authentication to restrict unauthorized access to sensitive information stored on networking systems. This helps address privacy concerns by ensuring that only authorized individuals can access patient data. Utilize encryption technology such as SSL or VPNs to encrypt data transmitted over computer networks. Encrypting sensitive information helps protect patient privacy by preventing unauthorized interception or eavesdropping on network communication. Regular security audits. Conduct regular security audits and assessment of computer networking infrastructures to identify and address potential weaknesses or compliance gap. By proactively identifying security weakness, healthcare organizations can mitigate privacy risk and ensure compliance with regulations such as HIPAA. Continuous monitoring and user accountability measures. Implement continuous monitoring solutions like IDS and SIEM tools, network traffic analysis solutions to monitor for suspicious activity and security incidents. Implement user accountability measures such as audit logs and access logs to track and monitor users' activities or computer networking infrastructures. Hold user accountable for their actions and enforce consequences for unauthorized access or misuse of patient data to deter privacy breaches. Incident response plan. Develop and regularly update an incident response plan that outlines procedures for responding to security incidents or breaches involving computer networking infrastructures. These plans should include protocols for containing incidents, investigating root cause, and notifying affected parties to minimize the impact. Vendor management. Establish strict vendor management processes to vet and monitor third-party vendors providing networking services or solutions to the healthcare organizations. Ensure that vendor adheres to rigorous security and privacy standards to mitigate risk associated with outsourcing networking activities. Security risk management and compliance investment. Prioritize cybersecurity and data privacy. Prioritize cybersecurity and data privacy considerations in networking infrastructures, planning, and implementation, develop robust risk management strategies, and ensure compliance with relevant regulations, such as HIPAA, to mitigate potential security breaches and regulatory penalties. Allocate a significant portion of the budget to strengthen security measures and ensure compliance with regulations such as HIPAA, investing in robust security solutions and privacy-enhancing technology can elevate privacy and security concerns related to networking. Next slide. Now on these slides, we will talk about the healthcare networking case studies and healthcare organizations leveraging networking to improve patient care. So one of the examples that we have is the electronic health records to improve patient care. So electronic health records help individuals, doctors, caregivers, and hospitals in various ways. For instance, patients have improved access to their medical information and are able to communicate effectively with healthcare providers. Doctors can quickly access patient healthcare and records, including medical history, lab results, and diagnostic images, which helps them make informed decisions on behalf of that patient. It enables nurses with effective workflow management, accurate documentations, improved care coordinations, and patient education and engagement. For caregivers, electronic health record makes it easy to access care information, communicate with healthcare providers, and update them about patients' conditions, coordinate care activities, manage medications, and much more. For hospitals, electronic healthcare improves patient safety by providing accurate and up-to-date information, reducing risk of medical errors. Electronic health records help centralize patient health information, including medical history, lab result, imaging studies, and treatment plans, which enables data sharing, analysis, and report for quality improvement initiatives and regulatory compliance. Electronic health record makes all of the above mentioned benefit possible, and networking infrastructures play a vital role in that space. Next slide. In this slide, we will talk about the partnership between healthcare organizations to address public health issues. So the government has come up with health information exchange, which deals with forming a database and sharing that with other healthcare industries. So the prime example of that is disease surveillance and outbreak detection that was done for COVID-19. Healthcare information exchange enabled real-time sharing of health data, including laboratory results, diagnostic reports, clinical notes, allowing public health agency to monitor disease trend, detect outbreaks, and respond quickly to emerging public health threats. By gathering and analyzing data from multiple sources, HIE supports early detection and containment of infectious diseases such as influenza, COVID-19, and much more. Yeah, go ahead, the next one. The other case studies we have is that the government initiatives that lead to innovative healthcare solutions. And the first one I have here is Health Information Technology for Economic and Clinical Health, HITECH Act. It was enacted as a part of American Recovery and Reinvestment Act of 2009. The HITECH Act incentivizes the adoption of meaningful use of electronic health records, EHRs, by healthcare providers through financial incentives and penalties. This initiative led to the widespread adoption of EHR. The second example I have is Singapore Smart Nation initiatives. So the Singapore government's Smart Nation initiative aims to leverage technology and innovations to create connected and digitally enabled healthcare ecosystem. Initiatives such as Health Hub, telemedicine platforms, and electronic medical records enhance access to healthcare services, promote preventative care and drive continuous improvement in Singapore's healthcare system. Next slide. So what's the future trend in healthcare networking? The future trend for healthcare networking is integration of Internet of Things, IoT devices in healthcare networking. The prime example of that is medication management system with IoT-enabled pill dispenser. Healthcare organizations can integrate IoT-enabled pill dispensers into medication management system to improve medication and patient safety. These devices can dispense the right dose of medication at the right time, while also sending reminder to patients and caregivers through healthcare network, reducing medication errors and enhancing treatment outcomes. And this is so much true in the world of IDD and the people with intellectually developed group of people. And one of the company who have the product, which I have tested, is called iCare. So the second trend we see is remote telehealth consultations via IoT devices. Healthcare organizations can integrate IoT devices such as video-enabled smart home hubs, telemedicine card equipped with IoT sensors to facilitate remote telehealth consultations. Patients can use these devices to connect with healthcare professionals for virtual appointments, share health data, and receive remote medical advices or treatment, improving access to care and reducing the need for in-person visits. Connected medical devices in hospital settings, integrated IoT-enabled medical devices such as infusion pumps, blood pressure monitors, and glucose meters into the healthcare network streamlines data captures and transmission. This integration allows automated data recording in electronic health records and facilitates interoperability between different devices, enhancing patient safety and clinical workflows. The final future trend in healthcare networking is personalized medicine and its impact on healthcare networking. The first one is genomic sequencing and data storage, or one of the big company who works on this field is GeneSight. Personalized medicine often involves gene sequencing to identify genetic variations that influence individuals' responses to treatment. Healthcare networking infrastructures must support the storage. Healthcare networking infrastructures must support the storage and secure transmission of large volumes of gene data between sequencing facilities, healthcare providers, and research institutions, ensuring accessibility for personalized treatment and decision-making. One of the examples that I know of through GeneSight is that using GeneSight testing to find the pathways for people which medicine will work for them or not. The second trend is electronic health records. Again, we are back to the trend that we have talked about before. Personalized medicine requires seamless integration of patient-specific genetic information into electronic health records. Healthcare networking infrastructures facilitates the interoperability between genetic database, electronic health record systems, and clinical decision support tools, enabling healthcare providers to access and utilize genetic data for tailored treatment plans. All you now.
All right. In conclusion, networking is not just a technical aspect of healthcare, but a critical enabler of collaboration, resource management, and patient outcomes. Despite the challenges, strategies can be implemented to overcome these obstacles. It is essential for healthcare organizations to prioritize networking and strategic goals, allocate resources for networking activities, provide staff training and support, and address privacy and security concerns through policies and procedures. As healthcare continues to evolve, integrating network technologies and trends will be key to driving innovation and improving patient care. Let us encourage healthcare organizations to prioritize networking efforts to realize the full benefits of enhanced collaboration, resource management, and ultimately improve patient outcomes. We want to thank you guys for listening to our presentation, and we hope you enjoyed it. Thank you.